After our introduction to Kyra set, I would like to show you how we can put a lumbar and the thoracic pedicle screws. Okay. Now you can see here already we put some pedicle screws at L3, 4 and 5. I'm going to show the L2. Before starting putting our pedicle screws, I would like to show you some anatomical details of the vertebra. As you can see here, we have transverse process like this. Another one. This is superior articular facet of the L2, and this one is inferior articular facet of the L1. Okay, this is the basically a facet joint here. What we can do is the entry point is the middle. We're gonna just draw a line perpendicular to the pelvis, or parallel to the transverse process, in the middle of transverse process like this, and another line perpendicular to the superior articular facet of this particular L2 vertebral level, and it's crossed especially in the entrance of the pedicle screw. And after actually determine our pedicle screw entrance here, I just remove this part with the ronger, bone ronger, and then I'm using directly my pet finder here. I generally use pet finders with curved tip. I'm gonna show you. This one is the curved tip, as you can see that. Why I'm using this one is, the reason is I'm using this one at the entry point in order to escape from the midline, okay, like this. And after going 20 millimeters inside of the pedicle, I take out this one, I control it with my sounding probe, medial, lateral, inferior, superior, and of course the fifth part is the anterior part. And if I encounter any kind of canal or soft tissue feeling, then I of course need to redirect my pet finder. After 20 millimeter, as you remember, I use like this. Okay. Now I'm gonna use like that because I already passed the pedicular level like this, and then I can do some toe in like this. Okay. And after that, again, I need to actually palpate all of the walls, pedicular walls, and the anterior part of the vertebral body wall. Afterwards, if you like, you can use tap. Normally, I never use tap in the normal cases, but if you have two holes, you need to use your tap. Otherwise, your pedicle screw easily escape to the wrong hole. In Kyra system, we have self-tapping, as you can see, self-tapping pedicle screws. As I mentioned before, for the close-up, I would like to show you our double fix system. As I mentioned before, especially tip of the screw is a kind of spongious bone threads, which are the widened threads, as you can see here. But when you look at the other part, the proximal part to the screw head is good for the cortical purchase, which is very important. Then you have double fix, especially good for the osteoporotic patients. Now, after putting our sounding probe here, I generally become parallel to the sounding probe and then remove it. Then I put my pedicle screw inside. Then I'm sure that I am in the same direction which I already created with my pet finder. So, as you can actually hear the sound of the double fix, as you can see that very good purchase we have. This is our lumbar pedicle screw insertion technique.